Hello, this is Nigel from One Life Training, answering more of your frequently asked questions. So, we are doing baby CPR, probably the most scariest type of CPR you may encounter. The same with all first aid scenarios, the first thing we always do is check for danger. We still need to check for a response. Obviously on babies, it's a lot harder to get. So basically all we're going to do is give them a little shake and call their name. Hello Eileen, Eileen, open your eyes. Eileen. Once we've established that there is no response, we then need to obviously open the airway. With babies this is slightly different, because if we open the airway too much we can then obviously occlude the airway again or close it. So all we need to do is put it in a neutral position like so. So the airway is now open. Obviously have a look inside the mouth. We do not start sticking our fingers in because you may end up with missing digits. So now we've established that the airway is open, I still need to check for breathing. So hold in the head, bring your ear to the mouth and look down the body. So baby Eileen is not breathing. I need to call for help. I need to get the ambulance. So how do I start CPR? So with all children-based CPR, the first thing we do is rescue breaths, and we do 5. So with a baby, we don't inflate their chest using the whole of our breath. We basically do 5 short breaths, like so. Once we've done our 5 breaths, on a baby, we use 2 fingers and we push directly in the centre of the chest 30 times, like so. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 23, 24, 25, 26, 27, 28, 29, 30. Once we've done our 30 breaths, we do 2 rescue breaths. And we continue 30 compressions, 2 breaths, until the ambulance arrives, or you're relieved, you're physically exhausted, or you're swapping with somebody. 20, 30. 30. And you keep going. If your one hand starts to get tired, swap. As long as you're maintaining the chest compressions, pushing a third of the chest. 28, 29, 30. Once again, if you believe you're seeing signs of life, have a check. If you don't believe they're breathing, carry on. Fifteen, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Hopefully this answers some of your questions regarding baby CPR.